Hi friends, I am Professor Kshitij Bansal. I teach law at Jindal Global Law School. The module that we are going to discuss today is National Law and Policy on Sanitation. Sanitation is one of the basic determinants of quality of life and human development index. Good sanitary practices prevent contamination of water and soil and thereby prevent diseases. Concept of sanitation was therefore expanded to include personal hygiene, home sanitation, safe water, garbage disposal, excreta disposal, and wastewater disposal. Prevailing high infant mortality rate is also largely attributed to poor sanitation. Proper sanitation is important not only from the general health point of view, but it has a vital role to play in our individual and social life as well. Sanitation is one of the basic determinants of quality of life and human development index. Sanitation is defined as safe management of human excreta, including its safe confinement, treatment, disposal, and associated hygiene-related practices. While this policy pertains to management of human excreta and associated public health and environmental impacts, it is recognized that integral solutions need to account for other elements of environmental sanitation as well, that is, solid waste management, generation of industrial and other specialized hazardous wastes, drainage, as also the management of drinking water supply. Good sanitary practices prevent contamination of water and soil and thereby prevent diseases. The concept of sanitation was therefore expanded to include personal hygiene, home sanitation, safe water, garbage disposal, and excreta disposal and wastewater disposal. What would you be learning out of this briefing? The main objective of this module is to understand the legal instruments that recognize the right to sanitation as a basic human right. This module shall also discuss the National Urban Sanitation Policy, which was released in the year 2008. It shall also discuss other significant problems dealing with the problems of sanitation facilities. Let me introduce you to the module to begin with. In a report titled Global Water Supply and Sanitation Assessment 2000, the World Health Organization and United Nations Children's Fund, UNESCO, defined sanitation as including connection to a sewer or septic tank system, pour flush latrine, simple pit or ventilated improved pit latrine, with allowance for acceptable local technologies. The excreta disposal system was considered adequate if it was private or shared but not public, and if it hygienically separated human excreta from human contact. There is a decisive link between sanitation and realization of other fundamental rights, like right to water and right to health. Sanitation and drinking water are linked as they're both addressed in an integrated manner. The vision of urban sanitation in India is that all Indian cities and towns become totally sanitized, healthy and livable, ensuring and sustaining good public health and environmental outcomes for all their citizens, with a special focus on hygiene and affordable sanitation facilities for the urban poor, women and children. According to census of the year 2001, 12.04 million people, 7.87% urban households, do not have access to latrines and defecate in the open. 5.48 million urban households use community latrines, and 13.4 million households, which is 19% almost, use shared latrines. 12.4 million households do not have access to a drainage network. 26.8 million households are connected to open drains. Article 21 of the Constitution ensures the right to life for Indian citizens, including all of these people who don't have access. Over a period of time, the Supreme Court of India and various state high courts have expanded the right to life as enshrined in the Constitution. India has been a signatory to many international conventions that treat water and sanitation as a human right. Right to life in the Constitution includes the right to water and sanitation as well. The higher judiciary in India has read the right to sanitation as a part of the right to life under Article 21 of the Indian Constitution. The landmark judgment in this regard is the case of Virendra Gaur versus State of Haryana, the year 1995. Court in this case first incorporated right to sanitation under Article 21 by ruling that enjoyment of life and its attainment, including their right to life with human dignity, encompasses within its ambit sanitation without which life cannot be enjoyed. Hygienic environment is an integral facet of right to healthy life, and it would be impossible to live with human dignity without a humane and healthy environment. The next landmark judgment in this regard was pronounced by Rajasthan High Court in the case of L.K. Kulwal versus State of Rajasthan in the year 1988, wherein the court stated that the maintenance of health, preservation of sanitation and environment, all of them fall within the purview of Article 21 of the Constitution as they adversely affect the life of citizen. The court also compared poor sanitation and environment to a slow poison by saying that this reduces the life of citizen. In Environment and Consumer Protection Foundation versus Delhi Administration and others, the Supreme Court had held that the right to water and sanitation has to be interpreted as a fundamental component of the right to education. The Supreme Court ordered that water and sanitation facilities must be provided at all schools for the sole purpose of realizing the right to education. The court further held that it is imperative that all the schools must provide toilet facilities. Empirical researches have indicated that wherever toilet facilities are not provided in the schools, parents do not send their children, particularly girls, to schools, which clearly violates the right to free and compulsory education of children guaranteed under Article 21A of the Constitution. And the Apex Court had directed all the states and the union territories to ensure that toilet facilities are made available in all the schools. Similarly, in AIDQUA Holdings, Mauritius Incorporated versus Tamil Nadu Water Investment Company Limited case, represented by its director and others, the Madras High Court, referring to United Nations Human Rights Council Resolution on Human Rights and Access to Safe Drinking Water and Sanitation 2010, stated that the right to water and sanitation is derived from the right to an adequate standard of living, which is contained in several international human rights treaties. Let us now talk about National Urban Sanitation Policy. The Government of India in November 2008 launched the National Urban Sanitation Policy, NUSP for our reference, with the goal of making India community-driven, totally sanitized, healthy and livable cities and towns. Along with this, the policy aims to sustain good public health and environmental outcomes for all citizens, with a special focus on hygienic and affordable sanitation facilities for the urban poor and women. The development of state sanitation strategies and city sanitation plans is an integral step in the process of improving urban sanitation. It instructs states to come up with their own detailed state-level urban sanitation strategies and city sanitation plans. The government also conducted a rating exercise to set a baseline for self-assessment of cities and highlighting the areas where improvements are required. The exercise rated 423 cities having population greater than 1 lakh for their performance across various aspects of sanitation. This was measured with the help of indicators that included physical infrastructure, systems, processes and outcomes related to achievement of total sanitation goal. The rating measures the sanitation performances of cities on 19 indicators, which sets out standards or benchmarks. The greatest ranking for that was the green category, which meant a total score of 91 to 100 points. However, no city in India could achieve that rank. The city of Chandigarh achieved the highest score with 73.480 points, followed by Mysore and Surat with a score of 70 and 69 respectively. The town of Churu in Rajasthan secured the lowest grade with 16.750, which fell in the red category. The tourist town of Srinagar in Jammu and Kashmir state also fared badly with a score of 17.179. According to a report released by the Ministry of Drinking Water and Sanitation, Sikkim is India's first state with 100% sanitation coverage. The state has constructed 98,043 household latrines, surpassing the target of 87,014 latrines. Of these, 61,493 latrines have been built for below poverty line families. The BJP government in its manifesto also promised to introduce sanitation ratings to measure and rank cities and towns on sanitation. Along with this, government has promised to set up efficient waste and water management systems. It also promised a clean India by Mahatma Gandhi's 150th birthday in the year 2019. Let me give you some interesting statistics now. According to the data released by 2011 census, around 53.1% of the total households lack access to sanitation facilities. This represents an improvement from the data in 2001, in which around 63.6% households lacked access to sanitation facilities. A significant proportion of this was in the rural areas, wherein the percentage of households having no latrine was at 69.3%. In the urban areas, the percentage was 18.6%. In a shocking news, the census has also revealed that more people in India own a mobile phone than having access to sanitation facilities. The Ministry of Statistics and Program Implementation, Government of India, also released a report titled Key Indicators of Drinking Water, Sanitation, Hygiene and Housing Condition in India in December 2013. The data for the report was collected between July 2012 and December 2012 during the 69th round survey of National Sample Survey Organization, that is managed by the ministry. The findings further reinforce the census 2011 figure, which had brought to fore the abysmal condition of sanitation in the country. The statistics reveal that 62.3% and 16.7% of households in rural India and urban India respectively did not have any bathroom facility. Among rural areas of state-wise, Jharkhand had the highest 90.5% proportion of households that had no bathroom facilities, much higher than the all India proportion, and Kerala lowest 9.7% in terms of proportion of households without any bathroom. This situation is relatively better in urban areas. Among all states in urban areas, Bihar had the highest 39% and Uttarakhand the lowest 2.4% proportion of households without any bathroom. It has been observed that during 2012, 38.8% and 89.6% households in rural and urban area respectively had access to improved sources of latrine. Let us now talk about Nirmal Bharat Abhiyan. Individual health and hygiene is largely dependent on adequate availability of drinking water and proper sanitation. There is therefore a direct relationship between water, sanitation and health. Consumption of unsafe drinking water, improper disposal of human excreta, improper environmental sanitation and lack of personal and food hygiene have been major causes of many diseases in developing countries. India is no exception to this. The government started the Central Rural Sanitation Program (CRSP) in 1986, primarily with the objective of improving the quality of life of the rural people and also to provide privacy and dignity to women. The concept of sanitation was expanded to include personal hygiene, home hygiene, safe water, garbage disposal, excreta disposal, and wastewater disposal. With this broader concept of sanitation, CRSP adopted a demand-driven approach with the name Total Sanitation Campaign, with effect from 1999. The revised approach emphasized more on information, education and communication, human resource development, capacity development activities to increase awareness among the rural people and generation of demand for sanitary facilities. This enhanced people's capacity to choose appropriate options through alternate delivery mechanisms as per their economic condition. The program was implemented with focus on community-led and people-centered initiatives. The financial incentives are provided to below poverty line households for construction and usage of individual household latrines in recognition of their achievements. Assistance was also extended for construction of school toilet units, Anganwadi units, community sanitary complexes, apart from undertaking activities under solid and liquid waste management. The Government of India later launched Nirmal Gram Puraskar that sought to recognize the achievements and efforts made in ensuring full sanitation coverage. The award gained immense popularity and contributed effectively in bringing about a movement in the community for attaining the Nirmal status, thereby significantly adding to the achievements made for increasing the sanitation coverage in the rural areas of the country. Encouraged by the success of Nirmal Gram Puraskar, the TSC was renamed as Nirmal Bharat Abhiyan. Objective is to accelerate the sanitation coverage in rural areas so as to comprehensively cover the rural community through renewed strategies and saturation approach. Nirmal Bharat Abhiyan envisages covering the entire community for saturated outcomes with a view to create Nirmal Gram Panchayats with following priorities. Number 1, provision of individual household latrine of both below poverty line and identified above poverty line households within a Gram Panchayat. Second, Gram Panchayats where all habitations have access to water to be taken up. Priority may be given to Gram Panchayats having functional piped water supply. Provision of sanitation facilities in government schools and Anganwadis in government buildings within these Gram Panchayats. Solid and liquid waste management systems for proposed and existing Nirmal Grams. Extensive capacity building of the stakeholders like Panchayati Raj institutions, village water and sanitation committees, and field functionaries for sustainable sanitation. Appropriate convergence with Manrega with unskilled mandates and skilled mandates. Objectives of Nirmal Bharat Abhiyan are as under. 1. Accelerating sanitation coverage in rural areas to achieve the vision of Nirmal Bharat by 2022, with all Gram Panchayats in the country attaining Nirmal status. Motivating the communities and Panchayati Raj institutions, promoting sustainable sanitation facilities through awareness creation and health education. To cover the remaining schools not covered under Sarv Shiksha Abhiyan and Anganwadi centers in the rural areas with proper sanitation facilities and undertake proactive promotion of hygiene education and sanitary habits among students. Encouraging cost-effective and appropriate technologies for ecologically safe and sustainable sanitation. Develop community-managed environmental sanitation systems focusing on solid and liquid waste management for overall cleanliness in the rural areas. The strategy is to transform rural India into Nirmal Bharat by adopting a community-led, people-centered strategy and a community saturation approach. The demand-driven approach is to be continued with an emphasis on awareness creation and demand generation for sanitary facilities in houses, schools, and for cleaner environment. Alternate delivery mechanisms would be adopted to meet community needs. The provision of incentives for individual household latrine units to the poorest of the poor households has been widened to cover other needy households as well to attain community outcomes. Availability of water in the Gram Panchayat shall be an important factor for sustaining sanitation facilities which have been created. Rural school sanitation remains a major component and an entry point for wider acceptance of sanitation by the rural people. Wider technology options are being provided to meet the customer preferences and location-specific, area-specific local needs. Convergence with Manrega shall also be important to facilitate the rural households with fund availability for creating their own sanitation facilities. How is Nirmal Bharat Abhiyan being implemented? The guidelines of Nirmal Bharat Abhiyan and the provisions hereunder are applicable with effect from 1st of April 2012. Implementation of Nirmal Bharat Abhiyan is proposed with Gram Panchayat as the base unit. Project proposal that emanates from a district is scrutinized and consolidated by state government and transmitted to the Government of India, Ministry of Drinking Water and Sanitation, as a state plan. Nirmal Bharat Abhiyan is to be implemented in phases with startup activities. Funds are to be made available for preliminary IEC work. The physical implementation gets oriented towards satisfying the felt needs wherein individual households choose from a menu of options for their household latrines. The built-in flexibility in the menu of options gives the poor and disadvantaged families opportunity for subsequent upgradation depending upon their requirements and financial position. In the campaign approach, a synergistic interaction between government agencies and other stakeholders is essential to bring about the desired behavioral changes for relevant sanitary practices. Intensive IEC and advocacy with participation of NGOs, Panchayati Raj institutions, resource organizations is envisaged. NBA will be implemented with the district as the project. States and UTs are expected to prepare revised NBA projects for all the districts consolidated at state level and state plan and submit before the Government of India. Components and activities for Nirmal Bharat Abhiyan implementation are as follows. Startup activities. These activities shall include production of preliminary survey to access the status of sanitation and hygiene practices, IEC activities, information, education and communication activities are important components of this program. They intend to trigger the demand for sanitary facilities in the rural areas. Capacity building. This component includes the training of members at block, district and grassroots levels in the functions related to health and education. Construction of individual household latrines. Construction of household toilets are also undertaken by the household itself, and on completion and the use of toilets and cash incentive can also be given to the households in recognition of its achievement. The incentive amount for the below poverty line households which have been identified as above poverty lines for construction shall be Rs 4,600 and Rs 5,100 for difficult and hilly areas. Rural sanitation marts and production centers. Rural sanitation mart is an outlet dealing with materials, hardware and designs required for the construction of sanitary latrines, soakage, compost pits, vermicomposting pits, washing platforms, certified domestic water filters and other sanitation and hygiene accessories required. Provision of revolving fund in the district. Revolving fund may also be given to cooperative societies or self-help groups whose creditworthiness has been established for providing cheap finance to their members. Community sanitary complex. Community sanitary complex comprise of appropriate number of toilet seats, bathing cubicles, washing platforms, wash basins, etc. and can be set up in place in a village acceptable and accessible by all. Institutional toilets. Separate toilet units for girls and boys should be provided in all co-educational institutions, which are to be treated as two separate units, and each unit is entitled to central assistance. Solid and liquid waste management. Objective of NBA is to bring about improvement in general quality of life in rural areas. Solid and liquid waste management is one of the key components to address it. The Union Cabinet, chaired by Prime Minister Narendra Modi, has recently given its approval for reconstruction and restructuring of the Nirmal Bharat Abhiyan into Swachh Bharat Abhiyan and revision in the components of the program. Recently, Bill and Melinda Gates Foundation have also expressed their desire to extend help in Swachh Bharat Abhiyan and health-related programs in India. Swachh Bharat Abhiyan will be divided into two submissions: Swachh Bharat Abhiyan Gramin and Swachh Bharat Abhiyan Urban. Budgetary provisions for the two submissions will be provided separately in the demand for grant of the Ministries of Drinking Water and Sanitation for Gramin and Ministry of Urban Development for Urban. Let us now conclude the discussion. Our discussion undertaken in this module went through the journey of Indian constitutional jurisprudence under Article 21 by way of some landmark Supreme Court judgments which recognize sanitation as a part of Article 21 as a fundamental right. This discussion can be summed up by recalling the important judgments that have been discussed, such as Virendra Gaur versus State of Haryana, which included right to sanitation within Article 21 for the first time, L.K. Kulwal versus State of Rajasthan and Environment and Consumer Protection Foundation case. The discussion also touched upon National Urban Sanitation Policy and Nirmal Bharat Abhiyan, which has been launched by the Modi government recently as key policy frameworks to implement sanitation as a country-wide goal to be achieved by 2019, when it happens to be Gandhi's 150th birthday. I hope this came across as interesting and informative. Thank you for listening.